Hello everyone, and welcome to Your Healthier Choice. I am Dr. Roopnarine, and we are coming to you live from our studios in San Fernando. On tonight's program, we're going to be discussing family medicine, more specifically, preventative care. In studio with me tonight is Dr. Brad Sahadeo. Dr. Sahadeo is a general practitioner with a diploma in family medicine and a diploma in occupational medicine. Dr. Sahadeo has his offices at the Personal Physicians Building in Marabella. As usual tonight, guys, our number should come up at the bottom of your screens. Please feel free to send in your questions and comments, and we'll do our very best to answer them during the program. So guys, let's get the show going. Let's talk about family medicine. Let's talk about preventative care. And let's say hello to Dr. Brad Sahadeo. Brad, welcome to the program. Welcome to Your Health, Your Choice. It's a pleasure to have you.
Thanks, Dr. Robin.
You're very welcome.
For the show tonight.
You're very welcome,
And
Brad.
good night to all the listeners.
Yeah, very good, very good. So, Brad, yourself and myself have been in communication really closely over the last month.
Yeah.
We've been working together, more or less, seeing patients, helping patients, monitoring patients. And I'm really glad to have you on board tonight to give the patients your unique perspective on family care. All right, Brad? So, I suppose one of the most important things about family medicine, which is my field as well, is preventative care. All right, that's one of the hallmarks or the base of the pyramid. That's why we do this, because we want to prevent people from getting sick. Right, and it's I suppose it's the aspect of care that brings the greatest reward for the population.
Correct.
Right, and I think that's where the aim of public health medicine is. So, Brad, like many times people come into the office.
Yeah.
Over the last few years, it's more common because people have company medicals and so on. But they would come into the clinic and they would ask for a checkup.
Yeah.
And they would say, I'm feeling well, but I want to evaluate myself to make sure that I'm not going to have any problems. I don't have any problems at the moment.
Yeah.
Right? And I think that's the trend that we see nowadays. So there are probably people at home in the audience, sitting at home and wondering, what is the components of a preventative health screen? What should they go in and have their doctor do for them to make sure that they're well over the coming year? So if you could just tell us a little bit about how would you approach that patient, what tests would you recommend for them, what sort of checks they should have to make sure that they're in good health and prevent illness and diseases for the coming year?
Okay, good question.
Yeah.
So first of all, when patients come to me,
Yeah.
right, we do a general, history and examination to start off with.
Yeah.
So in the history, we get the basic demographic information from the patient. So you get the age. Age is very important. So age will tell us what type of screening investigations we will do. All right. We also get things like the demographics. We said that already. So area where they're located, family history, stuff like that. All right. Those things are very, very important. All right. So patient comes to us, give us the history. All right. So when we get the history now, we move on to basic examination where we do their weight. Weight is very, very important. Right. From the weight and the height, we can calculate the patient's body mass index. Yeah. Right. If the body mass index is elevated, there's a higher predictor for chronic diseases like hypertension and diabetes.
Right.
All right. We do. Most patients we do, not if even all. We do a random blood sugar. If the patient is fasting, we do a fasting blood sugar on the patient.
So you basically screen for diabetes.
Screen for diabetes.
Yeah.
The population is rampant with diabetes right now. So we'll screen for diabetes.
Yeah.
My patients, so if you come for a general check, I do a urine analysis.
Right.
Urine analysis is a good screening tool. We usually test for like blood in the urine, any sugars in the urine, and also protein. Small amounts of protein is a high predictor of early kidney disease.
Right.
Yeah. So after we do the history and examination, we go on to the investigations. All right. So, age. We talk about age. All my patients, all right, 18 and over, I personally like to do a lipid profile. All right. So with a lipid
checking the cholesterol.
Checking the cholesterol. So what we like to look at is the total cholesterol and also what we call the low density lipoprotein. So the low density lipoprotein, the higher it is, the more at risk you are for arteriosclerotic disease.
Right. That point that you made there, sorry to interrupt, but
sure.
But that point that you made is really important, because I want to ask you, like patients will go to the pharmacies or maybe a pharmacy or just anyway and just get a cholesterol test done.
Yes.
And then they get a value.
Yeah.
What do you think about that? Or how would you advise them?
So I would advise them personally, you need to get, I'll go to a certified lab to get the cholesterol levels done.
Yeah.
All right, what the cholesterol levels look at is, as I said, the low density lipoprotein, and also which is like the bad cholesterol.
Exactly. So I mean, in terms of cholesterol testing, the most important thing really is not just to get a value, but to get an appreciation of the ratios and the profile of the cholesterol, because you have good cholesterol and you have bad cholesterol. And if you just do something over the counter somewhere, you're not going to have those ratios. And those ratios help your doctor analyze whether you need help or not.
Yes.
Right? You could go on there. So after your cholesterol checking, what are the kind of investigations you're running?
Right. So I didn't mention blood pressure.
Right.
Blood pressure is very, very important.
Right.
All right. So you come into the certain blood pressure, we get evaluated if the patient is hypertensive or not.
Right.
All right. I mean, sometimes when patients come to the office, they tend to be very anxious. Right. So you can get a one-off elevated high blood pressure. So, but most importantly, we do screening for high blood pressure.
Right. And in terms of the blood tests, what are the blood tests would you recommend to the public to have done?
Okay. So in terms of blood testing, I mean, routinely, it all depends on the patient. So I will do like a basic kidney profile. Right. So kidney profile will tell us if you have early renal disease. All right. And that's basically it for unless the history points towards something you need to look for that.
Exactly. Right.
Yeah.
Right.
All right.
So let's trim it down a little bit, because the majority, let's say a 60-year-old comes to the office to see a more senior person. I suppose that would determine what diseases you check for, right, based on the age. So what diseases would you recommend to the public that they should go in and see their doctor about to screen if you're over 60 years?
All right. So if you're over 60, it's either male or female. Let's take a male patient in consideration. So a male patient coming over 60, definitely prostate cancer among the most important. So you want to do what we call a PSA, or prostate specific antigen, which is a blood test, together with a digital rectal examination to assess the prostate. That's very, very important. Also, among some of the most common cancers, colon cancer. I would definitely recommend a colonoscopy. So colonoscopy will look for lesions, which is a predictor of colon cancer.
Right. So if I just kind of break it down, what you're saying there, you're saying basically for the over 60, you're looking at them, you're screening them. Obviously, you're screening for what most of Trinidadians know. You're screening for blood pressure, you're screening for sugar. Or diabetes, and you're screening for cholesterol, for sugar. You're screening also for any blood in the urine, any kind of infections. And you're also screening them for their cholesterol and also their prostate. If they're male. And if they're female, what else should they have done?
Right. So for female, pap smears. I will definitely do a pap smear. A pap smear will pick up early lesions in the cervix, which is a predictor for cervical cancer. Right. Next thing for women, definitely over the age of 40, mammogram. Right. So doing a mammogram annually, right, or biannually, depending on the patient's family history. Right. You will look for early lesions, such as that could be
to make sure to have breast cancer. Basically. So those are the tests that you do that you recommend people have for over 60. And what about people like your age group under 60s?
All right. So under 60, like myself, as I said again, family history is very, very important. All right. So just for example, let's say you have a positive family history of breast cancer, or positive family history of colon cancer, you tend to do screening a little bit earlier, right? So you tend to do screening as early as 40 years, right, in these particular age groups. Also, in female patients with a positive family of breast cancer, we also screen them for what we call the BRCA genes. So the BRCA genes is what we call genetic counseling. We do specific blood testing to see if they are positive for the genes.
So the other thing I wanted to talk about is that a preventative care package. I think we see these in the newspapers all the time. We see it advertised. Sometimes some tests are probably not necessary, and it really must be streamlined towards the patient's demographics, as you said, and also it must be streamlined to the patient what you pick up in your history and exam. Two things that I like to do as well, I think is really important, and I think that we've been under-testing people for thyroid disease in Trinidad. So I don't know what you think about that, but I like to send most patients who come into me who have never been tested for thyroids before, I like to let them have a test for thyroid. And I suppose the reason why is because the symptoms of thyroid illness could be so vague and broad spectrum, and not everything is in the book. And the patients certainly they're going to feel sick, they're going to feel tired, they're going to feel odd, and they're not really going to put it down to an endocrine or hormonal problem. And sometimes people think as well that you have to have a big swollen gland in your neck to have a thyroid problem.
Goiter, yeah.
A goiter. And that's not necessarily so at all. So that's why I like to screen people for thyroid disease as well. And obviously people might be anemic,
Yeah.
you know, and therefore we do a little blood count.
Blood count.
But definitely I agree with you. Those are important tests to have done on anyone. And I suppose you probably do it every year as well. Or?
Yeah.
Every year.
Every year.
So let's take that now, right? Because it's really important, because I get asked that question a lot in the clinic. What test you could do? I need a complete checkup. Tell me what a complete checkup involves.
Yeah.
Right? And I'm glad you answered that question, because people out there asking that question. The second thing I want to talk about, which is really common in general practice, and it's discussed a lot in Trinidad as well, but people don't really get the hard figures. It's hypertension or high blood pressure.
Yeah.
If you could just give us the hard figures. What is normal blood pressure? What is high blood pressure? What is low blood pressure? What's the range? And how would someone who's suffering from this problem of high blood pressure, how should they gather their data? How should they know what the readings are? How should they do it, and how could they help themselves?
Yeah. So first of all, we need to establish a diagnosis of high blood pressure or hypertension. So when the patient comes into the office, we do the blood pressure measurement.
Yeah.
Right? As I said before, sometimes it might be a little elevated.
Right. But if you could start with telling us what is elevated.
Right. So elevated is greater than 140/90.
Okay.
In the practice or in the clinical setting.
Yeah.
Right. But at home, 135/85.
Okay.
Yeah. Right. So that's
anything over 140/90, you said?
Yes.
And over in office, and anything over 135
over 85.
85 at home is considered high blood pressure.
That's usually nice guidelines.
Right. And I'm very conscious, but somebody might say, "But I'm not 135, I'm 130." What's the range? Is there any range values between normal and?
Yeah. So the lower limits of blood pressure is 90/60. So you don't really want to be going under that.
All right. So that's your range right there.
Yeah.
All right. So go ahead and tell us how you go about testing it.
Right. So first of all, when the patient comes in, right, we like to get the patient relaxed as possible. Right. Have them sit in, have them please relax, test the blood pressure. Usually clinic, you repeat it a couple times, right, to establish a diagnosis of high blood pressure. Right. If a patient has high blood pressure readings in the clinic, I usually send them home, right, to do what we call a logbook. Right. So in other clinical settings, they usually do something called ambulatory blood pressure testing. Right.
Which is the gold standard now.
Gold standard, right?
Across the globe.
But due to the cost and due to the convenience, we usually do home blood pressure measurements.
Can you tell the audience what is ambulatory blood pressure monitoring?
Right.
What is the gold standard? At least explain to them what it is.
Right. So basically, it is a cuff you put on the arm. Right. During normal working hours, let's say if it's for 12 hours for the day, right, while you're working, and you actually measure your blood pressure live. So you might measure your blood pressure while doing normal activities.
Right.
Yeah.
Right. And explain a bit more. How long do they wait for?
Right. So
what is the value of it?
Right. So you usually wait for about 12 hours for the day, right? During the working hours. After that, they take 2 readings every hour. Right. So after 2 readings every hour for the day, you take the 14 values, which are the lowest values. And after that, you find the average of those values.
Right. And that gives you a more accurate reading of someone's.
Yeah, more accurate. So it's actually the gold standard.
Right. So the value of that to the clinicians is the most accurate.
Most accurate, yeah.
And that's it. And it is available here in Trinidad, obviously.
Yeah.
So I think people need to know that. So, all right. So other than the ambulatory blood pressure monitoring, what else? How else do you measure it? You were saying.
Right. So the home blood pressure measurement.
Yeah.
So we encourage patients to get like an electronic device to test the blood pressure. It's readily available in most pharmacies.
Yeah, it's about $300.
$300. Yeah. The brand called Omron.
Omron.
Right. So you get these devices. You have the patient sitting, legs uncrossed.
Right. So let's explain to them how to take the blood pressure.
Right. So sitting.
Yeah.
Like this, legs uncrossed.
Yeah.
Right. Arms level to the heart.
Yeah.
Right. You put the cuff snugly.
Yeah.
Right. A couple centimeters above the elbow.
Yeah.
With the hand rested.
Yeah.
And to the level of the heart. Right. Put it on.
Does it matter which hand?
You could get, not really.
Not really, no.
Yeah. Right, to get the value. I usually like to tell the patients do it and then immediately repeat it like a couple minutes after. Right? You do twice a day, morning and evening.
So they're doing 2 readings twice a day?
2 readings twice a day, correct.
And they take the average of the 2
Take
readings.
the average of the both readings. I usually do it for about 7 to 10 days.
Right, and I think it's really relevant what you said there, that you made sure that it was a blood pressure monitor. From my experience, and hopefully others learn from by us discussing our experiences as doctors, I find the wrist monitors tend to give a lot of inaccurate readings.
Correct.
You definitely agree with that, which is good. So that's why we tend to recommend to the patients that, listen, if you're going to invest in home monitoring of your blood pressure, the best one to get is for the one for the arm and not really the wrist. What's the benefit of the one for the wrist? Have you got any benefit from it? Probably easier to use for some people.
Yeah, I think it's easier to use.
Yeah, but certainly in terms of accuracy of measurements, it's better to use.
Yeah.
Yeah, and right, so you have your patient at home, and they check the blood pressure. Now, a lot of times patients would say that, Dr. Robin, like whenever I come into your office, my blood pressure will be high, and you keep telling me about my high blood pressure, but when I go home and I check it, it'll be normal, right? And therefore starts the big debate: do you have high blood pressure or not, right? How would you answer those patients?
So
That's a common problem as well.
Yes, it's called the white coat effect.
Okay.
So the white coat effect is when patients usually come to the office, due to the hustling, and also due to the clinical setting and see the doctors, you tend to be a little anxious or nervous,
right.
and that by itself elevates your blood pressure. Right. So we usually take the home values, right?
Take the home values.
Yes, and once the home values are normal, patient is not hypertensive.
Yeah. I don't think people are usually that nervous when they come to see me, right? Probably, in fact, they sound pretty relaxed. But what I also realize that sometimes the machines that the patient using might be faulty.
Correct.
Because these things, as some of our technical people out there would know, usually used to have calibration a long time for machines, but these things nowadays are just so simple that once it's off, we don't really calibrate it, we just throw it away and buy a new one. So what I usually do as well is I would say, all right, your home reader, your monitor better than mine. Well, let's bring yours into the office and let's challenge mine, right? So what I would try to ascertain is the fact that both of our machines working. You know what I mean? And so I would have faith that their machine at home is accurate. And I would just take it with my machine and take it with their machine, and then we know that okay, your machine is good, my machine is giving us the same readings, and therefore we could trust your readings at home, and we know that your pressure readings at home are normal. Previous to that, way before your time and my time, I think it wasn't hypertension wasn't as much a data-driven diagnosis as it is now, right? High blood pressure now, we really need the data. We need 2 weeks of logging. We need to be looking back at it to make sure that once we've committed someone to that sort of diagnosis of high blood pressure, that we actually have the evidence to back it up.
Yeah.
I think previously to that, sometimes people were going to clinics all over the world, and they go to see a doctor, and the pressure is high, and the doctor gives them medication right away. So I always have this assumption, I don't know if you think it's right or wrong, and feel free to disagree, that out there in the world of high blood pressure, we have a lot of people who have high blood pressure, and we're not meeting them. And we have a lot of people who we have labeled as high blood pressure who who not really are hypertensive.
Yeah.
You know what I mean?
Yeah, I understand.
Would you agree with that?
Yeah, I agree.
So I feel we get in there and we're getting it right. And the most important thing for the patients to appreciate is that high blood pressure is not a quick answer like that. The diagnosis sometimes takes time, and the treatment sometimes takes time as well to get the results. So I'm Brad. We're going to take our first break. And when we come back, we could just talk a little bit more about that cholesterol that you were talking about, high cholesterol. All right?
Yeah, sure.
So guys, we're here with Dr. Brad Sahadeo. He's a family practitioner. He's based in Personal Physicians in Marabella. He's here to talk about preventative medicine. So I'd just like to formally invite you at home to send in your questions. Send in your questions and comments. If you have these problems or you want some advice, send it in to us, and Dr. Brad will do his very best to answer them. All right? Thanks, guys. We'll see you back in one moment.
You see, the only thing you got to worry about tomorrow is making sure that you make today count. This is your day to learn how to change your world.
I need you to focus on why you were born.
Let's not lose what made us, but let's grip the future. And let's become the best version for next year.
Most success is when a person develops ordinary qualities to an extraordinary degree through the application of hard, sustained work.
Now, for some people, this is not easy, but there is no good reason for not doing it.
You and I were created to make a difference.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
All right, guys, welcome back. We're here with Dr. Brad, and we're talking about preventative medicine, talking about high blood pressure, we're talking about high cholesterol. Please feel free to send in your questions and comments to us. So, Brad, before we went to break, and we were talking about the diagnosis of high blood pressure, how we really hammer it down there, right? So, what advice would you give to the people who are suffering from this problem?
All right, so I mean, in terms of the management and treatment,
Yeah.
right? First of all, we need to modify lifestyle modifications.
Lifestyle modification.
That's important. So diet and exercise, right? So the type of diet, there's a diet called the DASH diet, the DASH, which is a diet approach to stop hypertension, right? What they concentrate on is like whole grains, right? Decrease saturated fats, that's like your fries, fried chicken. We also do things like limit your alcohol intake, also increase your fruits and vegetables, right? In terms of exercise, the recommendation for exercise is about 30 minutes per day, 5 days a week, which is about 150 minutes for the week. We're talking about light to moderate exercise, which is basically walking.
Right.
Other forms of exercise, if you're doing vigorous exercise, let's say like you're doing jogging or running, you know, you can do about 75 minutes per week, which is about half the time, right? We also like to incorporate what we call anaerobic exercise, which is a bit of weightlifting.
Right.
But of course, with all these exercises, I mean, we take the patient into consideration also. The patient has heart disease and stuff, so all these things will be tailored. But it is important. All right. So we talk about the lifestyle modifications. All right. Alcohol, cigarette. Smokers, we tend to be very strict with smokers to stop smoking. Smoking is a high predictor for hypertension. Also, alcohol intake. Right? Yeah. After this, you know, we encourage things like weight loss. Also, it's our treatment and management.
All right. So I suppose sometimes somebody might be sitting down at home and going, I don't want to go and see Dr. Brad, because every time I go, he just tell me about diet and exercise. You know, but let's emphasize, like, I mean, how important is diet and exercise to the treatment? Is the pill better? Is Brad, just forget the diet and exercise, just give me a tablet. And that's the end of that. What would you say to someone who's thinking that?
Someone who's
because
thinking
that sometimes we get that sort of thinking as well.
Yeah, I think diet and exercise is just as important as taking your medication. Right? Studies show that if you diet and exercise, you usually drop your blood pressure by 10 to 50 units.
Exactly. That's true. And we've had diabetologists come onto the program as well. This show was formerly hosted by a diabetologist, and we're not curing diabetes, but we're putting diabetes in remission strictly from diet and exercise as well. Yeah. We have borderline diabetics have gone back to lower than 6.5 HbA1cs only with diet and exercise. So they're reversing it, right? But they're not curing it, but we're putting it back into remission, as I say, from diet and exercise. And the one thing I always tell people, I mean, what's the big picture? why you even want to get better? Why do you even want to treat? Because you don't want to die.
Yeah.
And you don't want to be sick, hopelessly infirm and unwell and miserable or not feeling well and then die. That's the purpose of us seeing them and treating them. And it has been shown, it has been independently shown, it's been the data is out there for decades now that irrespective of whatever other conditions, diet and exercise, especially exercise, has been proven to prolong your life.
Correct.
And to prolong a healthy life as well. And exercise has been an independent contributor to happiness. Right? So, I mean, so basically how I answer that, I say, like, well, you want to be happy in life and you want to live long. So the study has shown, the science has shown that exercise is the way to do it. That's how I usually, because it's the truth, it's the fact, it's the big picture. In terms of medication now, let's just really briefly, because we don't want to bog down people with pharmaceutical names.
Yeah.
What are the types of medication that they take?
All right, so it are different classes of medication, right? It have what we call the ACE inhibitors, right? It have what we call the ARBs, which are the angiotensin receptor blockers. It have the calcium channel blockers, right? It have other medication like the thiazide diuretics, or the diuretics, and other drug medications like the alpha blockers and stuff like that.
So the first question someone's going to ask, Brad, is, oh my gosh, I have this diagnosis of high blood pressure. I've tried my diet and exercise. I'm trying my diet and exercise, and Brad has put me on these pressure tablets. Would I need to be on these pressure tablets for the rest of my life?
The long and short, yes.
All right.
Yes, you need to be on the medication. Unless, I mean, if it's like borderline hypertension, as we said before.
Which responds well to the diet
and exercise, But most of the times, you need to continue.
So I suppose the way I look at it is sometimes you have medical conditions that, and diabetologists look at it as the same way as well. You have medical conditions that respond well to diet and exercise, right, and help you feel well. That doesn't mean that all that people with medical conditions that do not respond well to diet and exercise don't need you to do diet and exercise, right? But then you have a class of people who probably because of genetics, they might be very fit, and we have athletes up and down the world who are extremely super fit and suffer from chronic diseases as well. We have diabetics, we have junior athletes and senior athletes as well, national athletes, who are diabetic. And that's no new fault of eating poorly or poor diet and exercise because they're super fit. It's just genetics. So it just happens. And then they too also sometimes have high blood pressure. So it's important that everyone checks their blood pressure, even those who are dieting and exercising as well. You know what I mean?
Correct.
And I suppose if we carry on the discussion, we have a lot of people in Trinidad who also suffer from high cholesterol. Right? So tell us a little bit about high cholesterol, Brad.
So, I mean, high cholesterol. So the definition of high cholesterol, right, is basically elevated low-density lipoprotein.
That's
right?
the LDL that you're talking about.
Yes, remember we spoke about the different components of the cholesterol profile. So that's like the bad cholesterol. And the good cholesterol is what we call the HDL. So that is basically the definition of elevated cholesterol. This is important because it's a risk factor for strokes, heart attacks, and peripheral artery disease. So you have to be very strict in controlling your cholesterol.
Right. So somebody comes to the clinic and they have a diagnosis of high blood pressure, high cholesterol, sorry, and and we tell them diet and exercise.
Yes.
What next?
All right. So what do you usually do, right? It has different parameters you usually take in addition to the high cholesterol. Age is a factor. Your blood pressure is a factor. If you're a smoker, if you have a previous medical problem, for example, diabetes, right? There's a fancy tool they call the ASVD tool, which is basically a tool to punch in all these figures we spoke about, and it calculates the risk of developing heart disease.
Right.
Based on that, you could start lifestyle modifications or plus or minus a statin, which is medication to control the cholesterol.
All right. So I think everybody in Trinidad knows about cholesterol tablets or statins, right? I think they are the most widely prescribed medication in the world. Why are these drugs important? And because sometimes patients will be like, doctor, I heard that these drugs could be harmful to me. All right? And that's a common thing that we hear. That's a common complaint. The patients out there are worried. They read something on the internet that these drugs might be harmful to them, or they genuinely they met someone who had a problem with the drugs. How would you advise someone like that?
All right, somebody comes in to me and they have a problem taking that's a common problem.
Yeah.
Most of the common, they think that something is going to go wrong if they take the medication.
Yeah.
Right, but you counsel them that the risk of not taking the medication.
Yeah.
Right.
Yeah.
The risk of taking it basically outweighs that.
Right.
So you prevent, as we said before, you prevent heart disease.
Yeah.
Right. Peripheral artery disease and even developing strokes.
Exactly. And I mean, we can't ignore it though. I mean, we must counsel people and let them know that there are side effects to the medication.
Yes.
And if you can just tell them what the common side effects is.
So the common side effects of the cholesterol medication is muscle pain.
Yeah.
Right. So a lot of patients and they get muscle pains.
Yeah, it's common.
Yes, and some patients get like nausea from it and stuff like that with the medication.
And what would you recommend to these patients to do?
Right. So there are different types of statins.
Yeah.
You could usually switch statin to see if you get some form of relief from that.
Yeah, I tend to approach it like that as well.
Yeah.
What I usually do is definitely the statin. I would give the patients. I tend to give people who suffer from high cholesterol, give them an opportunity to clean up the act.
Yeah.
Everybody's sometimes a bit naughty, right? You know what I mean? It's been tough. It's been a tough 2 years, and sometimes you give them a chance to get their life back in order and clean up the act, and they retest it, and things could go back to normal.
Yeah.
All right. But sometimes as well, if you consider the other factors like their family history and stuff, a statin is a really good choice.
Very good choice.
And sometimes if someone gets a side effect of a statin, the teaching is that, hey, look, don't panic. We'll check their liver function as well, because sometimes you get liver function disorders. We evaluate what's going on. But sometimes we could vary your dose. We could change the brand, and we could find something that is quite suitable to you. And there's so many different options available to the doctor. So many different options that we have been able to, and I mean, at least in my experience, being able to find something that works for someone, you know. And the other important thing about statins, like sometimes people say, well, my cholesterol not too bad, why you have me on a statin? But as a cardiologist would say, the statins allow for stability of the plaques.
Yes.
And that's a real big plus, because the statin is not just only to bring down your cholesterol level. That's a plus, yeah. But in Trinidad and in this type of populations, we have a problem. We have a unique problem with the instability of plaques, where these plaques tend to break off. These cholesterol plaques tend to break off and go to the small arteries in your heart and cause heart attacks.
Heart attacks.
So therefore, I mean, I need people to understand this as well, that we have a huge amount of people in the population who don't necessarily have high cholesterol or really high cholesterol as you think, but it's borderline cholesterol, high cholesterol, who have had heart attacks. And that generally is because of the instability of the plaques. And it's really sad, because the great news is that sometimes the statins on their own are able to sort of add stability to those plaques. And sometimes that's one of the reasons and all that I put people on it, not necessarily because the cholesterol is too high, because I think that will help add stability to the plaque, especially with the family history, where someone might have a family member who would have died from a heart attack at a very young age. And I'm doing my part to help them by giving them this medication, which should sort of stabilize any cholesterol plaques. I don't know what you think about that.
Yeah.
that makes sense.
Makes sense.
So another common question I get in the practice as well, Brad. So I'm just basically just giving you all the questions that I get in my practice.
Sure.
Sometimes people ask me, Robin, does stress kill? You know, and I've been thinking about that recently a lot too. And they would say, like, could you get sick from stress? How would you answer someone who asks you that question? What is your answer to that question? I'm asking you, Brad, Dr. Brad, can stress kill you?
So first of all, I'll try to counsel the patient what is actually stress.
Yeah, what is stress?
Right. So stress is basically the physical and mental response to stressors in somebody's life, or challenges, we call it.
Challenges.
Yeah. Right. So it could be it could be a good thing, or it could be a bad thing.
Yeah.
Let's take a good example. Let's say, for example, I stress somebody writing an exam.
Yeah.
All right. Your body tends to trigger what we call the autonomic nervous system, and you tend to cope better with the exam by being more alert and being more mindful of the exam itself. But sometimes these stressors tend to be persistent. Let's say, for example, somebody going stress at home and stuff like that.
Yeah.
Then you start to get the physical effects and the mental effects associated with prolonged stressors.
Right.
And that's when the bad side of stress, basically. Right? Physical signs, you get headaches, nausea, dizziness, abdominal pains, you get reflux disease, you get muscle, and then the mental part comes in. We get like anxiety, depression, and there's overwhelm.
Yeah. So what I'm getting from you is that stress, that sort of intangible feeling or sensation that comes from the external environment,
Yes.
sort of overwhelms the body and causes many different illnesses and symptoms.
Correct, yeah.
But can it kill you?
I would say yes. I'll say yes.
Why would you say yes?
The reason being because stress.
And no, there's no right or wrong answer to the question.
Yeah.
But I was just asking your opinion.
I mean, the stress response produces certain hormones in your body
Yeah.
that trigger off certain diseases.
Yeah.
Things like high blood pressure,
Yeah.
things like diabetes.
Yeah.
Right? And these things in the long term can cause end organ damage and eventually cause death.
Yeah, yeah. So I would say something about like previous to your time, and probably a little bit previous to my time as well. You know, somebody asks the doctor that, maybe like, well, stress not really going to, what is stress? It's not going to cause, but hey, the game has changed, huh? The game has changed, the pandemic, the world all over, different problems, and I think nowadays we see, and we actually hearing cardiologists and diabetologists and specialists saying, hey, stress has a big impact on someone's physical health.
Yeah.
And as Mr. Feroz Abdul constantly reminds me, mental health is a big part of physical health, and you can't have health without mental health. And in fact, that's the WHO World definition of health, involves mental health as well.
Yeah.
And yes, people, the mental health could affect your body, and well, I suppose my answer to the question now is yes, because it could kill you, because it could send your chronic diseases way out of control. It reduces the inflammatory markers. It could cause you as a person to not be interested in your own health or not participate. And the problem about the problem and or the thing about healthcare is that the patient has to be the active participant. You know what I mean?
Yeah.
You can't get better unless you want to get better. And as a patient,
Yeah.
the doctor can't do anything. And if a patient not mentally feeling well or not there because of stress, obviously they're not going to get the best outcome in terms of their health, and they're going to go downwards. So that's my take on it. Obviously, it reduces corticosteroids as well, which causes obesity, could cause sluggishness, cause muscle fatigue, muscle weakness, send your sugars up, increase your pressure, as you said, and it leads to other problems as well. It's just the last straw that breaks the camel back sometimes. So the reason I asked you that question, the reason I put it out, is because it's very important for the public to understand that. Because it seems nowadays that everyone is under a lot of stress. I mean, we're laughing at it because sometimes we're under stress as well, you know. And obviously people are under stress because of the economics. The pandemic was really hard. Things that country, you know, a lot of this administrative issues that are going on in the country. Floods, rain, it's just, everything's causing a lot of problems, and it's stressing people out, whether they realize it or not, and it causes a health response. What do you think about that?
Yeah, I think so.
What's your comment on that?
I mean, we are facing post-COVID right now.
Yeah.
Economic depression.
Yeah.
Yeah. Based on that, I mean, a lot of people have been faced not being able to fulfill financial obligations.
Yeah.
Yeah. Based on that, you're stressed out. We talked about stress before.
Yeah. I'm actually put on a public health hat, so to speak. What do you think is the impact on healthcare for the future of Trinidad and Tobago, given that we're in a sort of recession, debatable apparently, or what problematic economic times, people in trouble financially. What is your view of how that would affect healthcare or health in Trinidad and Tobago?
Yeah, I think so. I mean, in terms of people accessing healthcare, it's a big thing.
Yeah.
Right? We talk about the chronic illnesses, we talk about diabetes, we talk about high blood pressure.
Yeah.
Yeah, people not just seeking healthcare. That's one.
Yeah.
Also, a next big thing. I mean, all these. We talk about lifestyle modification and diet and stuff like that.
Yeah.
How are these people going to afford these healthy foods and stuff to kind of help with their control of the diabetes and high blood pressure?
Yeah. So like a few months ago, me and myself and another doctor, speaking a very senior doctor, and I said to him, well, if you continue saying what you're saying, then traffic should be declared a public health emergency.
And stress.
Right? Traffic should be declared not only crime, but traffic should be declared a public health emergency, flooding as well. Because and why? Because and the economy as well. Because obviously, I mean, healthcare is so intrinsically linked to the well-being of the people and the community that if you have a person who is under economic stress and doesn't have the financial resources, it's difficult sometimes. I'm not saying it's impossible, because in Trinidad we grow lots of fruits and vegetables, but sometimes it's difficult if they're stuck in traffic all day long, they're not exercising, they reach home, the kids have to leave, get home early or whatever. It's difficult for the traditional sort of preparation of meals, healthy meals. It's difficult sometimes to get them outside to exercise. It could be difficult, and also as well, the stresses itself could lead to them having the chronic diseases, and then sometimes, yes, the healthcare in Trinidad and Tobago is free to a large extent, but sometimes people need to purchase certain things, such as investigations of bloods and medications, and these things ain't cheap.
Yeah, not.
And so what happens then to the health of the population?
Yeah.
So sometimes my point is that sometimes when we're planning things in this country, or anyway, we must think about the health of people. So traffic could cause health problems.
Yeah.
Traffic is a big cause of health problems, and we've come to that realization recently enough. When we come back from the break, Brad, we're going to talk a little bit about mental health.
Yeah.
And we'll go into that as well, and we take some more feedback from the audience. All right, guys? So we're here with Dr. Brad Sahadeo, and we're talking about preventative medicine, general health, family medicine. Feel free to contribute to our discussion. Tell us what you think, and certainly ask Brad any questions that you may want to ask as well. All right, guys? We'll see you back in one moment.
You see, the only thing you got to worry about tomorrow is making sure that you make today count. This is your day to learn how to change your world.
I need you to focus on why you were born.
Let's not lose what made us, but let's grip the future and let's become the best version for next year.
Most success is when a person develops ordinary qualities to an extraordinary degree through the application of hard, sustained work.
Now, for some people, this is not easy, but there is no good reason for not doing it.
You and I were created to make a difference.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
All right, guys, welcome back. We're here with Dr. Brad, and we're talking about general practice. Brad, I suppose, very importantly, how people are under a lot of strain. We just discussed that. People have a lot of mental health issues. What are the common type of mental health issues that you see coming into your practice, and how do you advise the patients?
Okay, so the most common mental health disorder, depression and anxiety.
Mm-hmm.
Right, so depression and anxiety for me, tops in terms of mental health.
Right.
All right.
What is depression?
So depression, depression is, there's so many definitions. That's generally feeling depressed, but you have certain symptoms associated with depression.
Yeah, if you could just educate the audience of these symptoms.
So sleep. You have altered sleep pattern as one. Your weight tends to fluctuate.
Yeah.
Either weight gain or weight loss. All right? In terms of irritability, you tend to feel a little bit irritable as compared to others.
Yeah.
Right? In terms of being easily aggravated and stuff,
yeah.
that also tends to be linked to depression. Also, you feel guilty for certain things that may have occurred at home or things that you're doing at home.
Okay.
You have something called anhedonia, which you lose interest in doing common things. For example, if somebody was accustomed playing sports or doing certain hobbies, they just stop doing it all of a sudden.
Right.
All right. The most important thing about depression, suicide.
Right.
Have to screen all the patients who are depressed.
Yeah.
Screen them for suicidal thoughts or suicidal ideations.
Right.
That's very important.
Have you seen an increase in number of patients coming in with mental health?
Most definitely.
Yeah.
Most definitely over the last couple of years.
Yeah.
From the COVID pandemic straight to now.
Right. To someone who's suffering from depression out there in TV land, in our audience, speak to them. What would you tell them to help them feel better, or get better, or to overcome this medical illness?
I mean,
and bear in mind I said medical illness.
Yeah.
Because I want people to know that sometimes the public could sort of stereotype and stigmatize people with
which shouldn't be.
Which should not be. This is a medical problem.
Yeah.
So tell the audience.
So treating depression, I think is a multidisciplinary approach, right? To start with the family physician, together with psychotherapist or counselor, right? Together with a psychiatrist. I think is what we call a multidisciplinary approach, right? Depending on the severity. Obviously, that's where we screen the patients.
Yeah.
I spoke about suicide and suicidal thoughts and stuff like that.
Yeah.
All right, but most definitely, what we do, I mean, we do conservative treatment.
Yes.
Conservative treatment is like relaxation techniques,
yeah.
right? Exercising, doing things like yoga, coming out, taking part in hobbies, stuff like that.
Why is that important?
It's important.
To get them to solve this problem.
They say that by doing activities, by running or walking, you release the happy hormones, which is like the dopamine.
Yeah.
And that by itself is a remedy for depression.
Yeah.
Yeah?
Yeah. So, I mean, sometimes it's really a medical, I keep emphasizing medical problem because sometimes it's a hormone in your brain.
Yes.
It's a hormone in your brain, just like sometimes you lack insulin in your body that could cause you to become diabetic, or the insulin response, or you lack testosterone in your body that can give you certain neurological problems. Sometimes the hormone in the brain to help you feel good is depleted.
Yes.
So it's a real medical problem. And then the exercise helps increase the amount of the happy hormone. It's serotonin, isn't it?
Serotonin, yeah.
Yeah. So that's why exercise is important. It's almost like a pill, isn't it?
Correct.
So what else would you recommend to them?
All right, so you spoke about that, right?
Yeah.
Things like, we talk about exercise.
Yeah. This is depression we're talking about.
Yeah, very important. I think what we need to assess all the depression is counseling. Counseling is very important.
Yeah. What does a counselor do for them?
So counselors, they have different techniques.
Yeah.
One of the most common techniques is something called CBT, which is cognitive behavioral therapy.
Yeah, what is that?
So what they do, they try to assess what is negative, the negative thoughts and stuff like that, and try to convert these negative thoughts into positive thoughts.
Yeah.
Right, and that's part of the treatment process for depression.
Yeah.
Yeah.
Yeah. And I suppose what you do, you recommend these exercises, this counseling, and then you see them back.
See them back to see if they're doing better.
Yeah.
If they are not doing better now, you may have to start medical management.
Right.
Right. But personally, as a general physician, when I reach that age, I like to get the consult of a psychiatrist at that time.
Of course, because it might need specialist attention.
Yeah.
And sometimes, I mean, what you just described, if you really push it, and good counseling, they really don't end up to this. People don't really end up needing medication that much.
Yeah.
And if people need it, they need it, and they get better.
Yeah.
So the key part of it, I suppose, is when I talk to patients with depression, or clinical depression, I tell them, well, you're feeling like this now, but you're going to get better. Because I know you're going to get better.
Yeah.
Because the science has shown me that you will get better. And even when we didn't believe the science, we prove it that you will get better. And then they start to feel better one time too as well, because they realize there's hope. But they do get better, and exercise does help them get better. And counselors, we've had them here on the program before, they are very good at helping people analyze their problems. What about anxiety? What do you think about anxiety? How do you help people with anxiety?
Same, it's along the same lines. Anxiety tends to be linked to depression. Being over anxious, it tends to be depressed after.
Yeah.
So it's along the same lines.
Yeah.
But anxiety, you tend to feel anxious about common things, right? Over anxious.
Yeah. When you say common things, I'm hammering you down here a little bit, right? I'm going to jam in a corner. What do you mean by that?
We spoke about traffic all the time.
Yeah.
Let's say every day somebody is just exposed to this high traffic all the time.
Yeah.
You tend to feel anxious, feel nervous when going to work.
Finances,
stuff like that.
Sometimes, if you really look at the bigger picture, I was thinking about this today. Sometimes people feel anxious because they don't have answers to the problems.
Yeah.
right? We have not, I won't call it problems or the obstacles, right? So if someone doesn't have an answer or a solution to an obstacle, obviously they're going to be lingering in a sort of anxious state. This is a subgroup of anxious patients. You know what I mean?
So like overthinking.
Overthinking, or not having a solution.
Yeah.
Because if you get a solution, you're going to be overthinking. So that led me to thinking as well. That's why mentors are so important in a society. That's why people who have a position of authority should give people solutions. That's why professionals like yourself and myself must work people through to get that answer to their problem.
Yeah.
Because once a person doesn't understand how to get a solution or doesn't have an answer to their problem, they're stuck in limbo, and therefore they're stuck in anxiety sometimes. So that's why it's important for people to talk to people and to reach out to people, sometimes a senior person, like grandpas or senior people in the community or elderly people who have real experience.
Yeah.
Because they walk the road already and they have the answer. And sometimes it's hard in Trinidad to have that sort of communication. Sometimes we need people out there, the senior men out there, to stand up and reach out to people and give them the answers and give them solutions and guide them through the problems that they may have.
Yeah.
Does that make sense?
Makes sense. I think there's a element we are missing here.
I think so. And I think that sort of the wise heads have to help the younger heads through. Yeah, so that's what I think about in terms of mental health and anxiety as well, and I would agree with you. Obviously, there's other things that could be triggered off, such as schizophrenia and suicide as well, and those really need a specialist as well. So in terms of let's say the other common things that come into the general practice setting as well, that people might want hard information about is, let's say, abdominal pain.
Yeah.
It seems like nowadays a lot of people complain about, let's talk about like bloating and acid reflux. That's a common presentation in the general practice. How would you approach those patients, and what advice do you have to give them?
All right, I mean, we start off again, history examination. That's very important.
Yeah.
We take the history of our abdominal pain.
Yeah.
So we know like the onset of the abdominal pain.
Yeah.
We know how this abdominal is progressing, if it's getting worse, if it's getting better.
Yeah.
Right? You want to know things like the qualitative pain, if it's a sharp pain, that's a sicking pain.
Yeah.
The pain is moving.
Yeah.
The pain is localized.
Yeah.
Right? What makes it better? What makes it worse?
Let's hammer it down specifically to acid reflux or gastroesophageal reflux disease.
Yeah.
That's a real common problem in Trinidad. And it seems to be a chronic problem.
Yeah.
What is it?
So gastroesophageal reflux disease, or GERD, is basically when the stomach contents tends to reflux.
Right. Right.
Yeah. So that is basically the definition of GERD.
And what causes it?
It's an increase in acid production.
Yeah.
That is one. So if your stomach is producing excess acid, right, most of the times triggered by that. So if you're eating poor, your body tends to produce more acid, and it brings up acid as a reflux disease.
Right. And what are the symptoms that the patients get?
Right. So the symptoms, they feel the contents like a bitter taste into the mouth.
Yeah.
That is one.
Yeah.
They tend to also feel a little bit nauseous, a little bit soft when they're eating, right?
Yeah.
Like acidic foods and stuff.
Yeah.
And also, they tend to get this gnawing pain in the middle of the stomach.
All right.
Yeah.
All right. I suppose that as well too, they have rare symptoms that people don't think about when acid reflux too.
Yeah.
Sometimes a cough.
Yeah.
And that's like that's like probably one of the most common presentations in general practice. People coughing all the time, right? And sometimes it could be acid reflux. Sometimes the dentist also notice erosions in someone's teeth. So sometimes the dentist might tell to this patient, hey, you have acid reflux, and tell your doctor to treat you for acid reflux. And sometimes as well, they could, I think ENT doctor, I don't fully understand why we told people get ear infections from acid reflux. Have you heard that before?
Yeah, the reason is because when you get the reflux of the stomach contents, there's a passage, it goes up the nasopharynx into the eustachian tubes, affects the ears.
Right, and how would you recommend that someone treats this problem? Because it's a problem. Yeah. How would you treat it?
We start off again conservative lifestyle modifications.
Yeah.
Right? Try to lose some weight.
Yeah.
Increase abdominal pressure causes stomach contents to go up.
Yeah.
Yeah. So you control the weight. Diet.
Yeah.
Try to limit the foods that produce plenty of acids in the stomach.
Right.
Like the spicy foods, the oily foods, and the greasy foods.
Right.
Things like that. Right? So and then obviously after your modification, if these things don't work, you go into some medication.
Right, and what kind of medications?
Right, so there's like the proton pump inhibitors, and there's like the antacids.
Right.
So the proton pump inhibitors, don't need to call the brands and stuff. Yeah.
Right.
Yeah, but yeah.
And at what point should someone have an endoscopy done? It's a common question I get asked as well. People sometimes say, Robin, send me for endoscope. And I said, hey, you sure you want to go for endoscope now? When you would send someone for endoscope?
I will send somebody an endoscopy if
Yeah.
the symptoms are prolonged.
Yeah.
That's one.
Yeah.
After field lifestyle modification, field medical management,
Yeah.
and the problem is persistent. That's
Yeah.
one.
Yeah.
You look at very alarming symptoms also.
Yeah.
You want to look at weight loss.
Yeah.
If somebody's having weight loss and is having genuine reflux problems,
Yeah.
I'll do an endoscopy just to make sure.
Blood as well, I suppose. Just
Blood,
putting up blood,
correct.
bringing up blood.
You're spitting a lot of blood up,
Yeah.
that's a warning sign.
And I think the key part about acid reflux treatment, if you could do it at home, is to really eliminate foods.
Foods, correct.
Yeah, eliminate certain foods. And it's not only about eliminating the oily food and the spicy food, but it's also about like eliminating gas-producing foods like beans and
stuff.
probably broccoli a little bit.
We're going to talk about alcohol, cigarettes.
Alcohol, cigarettes. Cigarettes is a big cause of acid
Yeah.
reflux. Hard for people to comprehend why, but it's hard for me as well to understand why, but it does.
Yeah.
Alcohol as well. And also like the gas-producing chana and stuff like that. You have to
Beans
be careful,
and-
beans and all that. And not missing breakfast. It's a big win how to prevent this problem.
Yeah.
And eating small regular meals, all right? I think that's the key part of it as well. So Brad, at this we've come to the end of the program. I'd just like to thank you for coming on tonight.
No problem.
I think it's a field that's my baby as well, and I really enjoyed your company tonight. I enjoyed your support in bringing out the key elements of general practice to the audience, and I think we sort of discussed a lot of the stuff that me and yourself have seen over the last month in the practice as well.
Yeah, correct.
And I'd just like to thank you for coming out tonight.
My pleasure.
All right then. All right, guys. So that's thanks again to Dr. Brad Sahadeo for coming out tonight and assisting us in this discussion about general practice. And I'd just like to thank you at home for tuning in tonight. And I'd just like to wish everyone, I know it's a very rainy night out there tonight. They've been flooded in parts of Trinidad and Tobago. I just want to wish everyone all the very best. Keep safe and God bless you all. All right, guys. So we'll see you all again next week. Take care, everyone. Have a pleasant evening and good night from tonight. Well done, Brad.